certainly are reflected by the Pan American Health Organization Director, Carissa Etienne, who said in April this year that misinformation is one of the most serious threats to public health. And she's quoted as saying that every person is a vulnerable group that is hesitant to get the vaccine can become part of a sad statistic, one of the thousands of deaths that may occur daily due to COVID-19. So while we're talking about vaccine hesitancy, certainly I'm sure you'd want to put out the message that you need to go take the vaccine because you could become part of that sad statistic, as Dr. Carissa Etienne said.
That's right. There are a couple. So what we have learned from the research is that there's no one message that we should give out to patients. We should try to reach out to the patients and to the public at the level of their worry and speak to them. So I will say that if we want to get out of this pandemic, if we want to end the lockdowns, if we want to end the curfews and the state of emergency and go back to, sort of normal life, the vaccine is the key way to do that. If we look abroad at Israel, the United Kingdom, and the United States, these countries have been vaccinating, and as the more they're vaccinated, the more they've been able to open up, while their cases have kept on declining. So we can see that the vaccines are efficacious. Also, another way to look at it is if you're not worried about your own health, please remember that there are vulnerable persons around you, your elderly grandparents, persons in your family who might have diabetes or high blood pressure, which is very prevalent in the Trinidadian and Tobagonian society. And these persons are at increased risk. So by you taking the vaccine, you're also protecting them as well.
Does the research show that any age group in particular is more hesitant than others in terms of getting the vaccine?
I didn't come across any figures to that point, but what I did come across was that in a study done in the United Kingdom, it found that persons who were of Black or South Asian, meaning Pakistani or Bangladeshi background, they were more hesitant than the white population to take the vaccine. And it seems that the latest flares and outbreaks that have been happening in the United Kingdom have been among those populations who have not been vaccinated.
Yeah, there seems to be some demographics which are reluctant to go ahead and take it. Now, in terms of those who you would encourage, of course, those who are vulnerable, those vulnerable groups, they and their families, because some of these vulnerable groups are not able to do a lot of these things for themselves, you would encourage them and their families to go and get vaccinated, especially if you are in a vulnerable group. Could you just explain to us what are some of these vulnerable groups?
Absolutely. So the vulnerable groups at this time tend to be older persons over 60 years old, as well as persons with comorbid illnesses such as diabetes, high blood pressure, asthma, or other medical issues. These are the persons that seem to be at higher risk of poor outcomes from the illness.
Right. So those are the main ones. And in terms of encouraging people to go out there, what would you say to them?
So what I would say is I would appeal to those persons in the community who have had the vaccine or know people who have had the vaccine to speak to others concerning their concerns. Try to understand their concerns and not shame them, because there are a lot of legitimate doubts, all right? And there's a lot of things that have been said in the social media and online. So persons can have doubts, and that's reasonable. But the best way going forward, I think, to help persons to decide to be vaccinated is if the respected members in their communities, such as religious leaders, political leaders, or, their own family members who have had the vaccine and had, good outcomes, if they speak to them about their concerns and try to answer their questions.
You're listening to U975 Hot Like Pepper Multicultural Radio, part of the Rhythms Communication Network. We're speaking about vaccine hesitancy, and we have Dr. Shivan Mahabir on with us. He's a psychiatrist, and he is chatting with us about the topic. And one of the things that really struck me about about this whole situation of the vaccine, Shiva, is that many people use some of the companies that produce these vaccines. They use products from these companies to treat other ailments. But for this particular virus, COVID-19, they are very reluctant to use these medications from the same company. What to you explains that?
Well, I think that one of the big issues that a lot of people have spoken about is the feeling that the vaccines were rushed, and they're questioning whether enough testing was done to give a proper idea of what side effects may come or what may be the long-term effects. To me, that, I think, is the biggest worry that I have heard from the public.
Yeah, and I think some of the countries where some of the vaccines have been produced with questionable human rights backgrounds, those that also seems to add to it, because you hear people saying, well, I don't trust anything coming from that country.
Mm-hmm. So, you know, some people blame a particular country for the whole evolution of the virus.
Right.
Some people believe that it originated in a particular country, and they blame them. And they also say that, you know, they think that the things that are coming from that country are substandard.
Right.
All I can say to that is that these vaccines that we are using in Trinidad have all been evaluated by a panel of international experts at the World Health Organization, and they have expressed their confidence in the efficacy of the vaccine. And the other thing that I would say is that whereas we may want to say, okay, we believe in another vaccine more, we're not sure when we're getting some of those other vaccines. And in the meantime, we are seeing cases spiking, 500 a day, 600 a day. We're seeing people dying in the double digits every day. So it's a clear and present danger presently. And we need to take the steps that we can right now to try to mitigate the risk.
Yeah, we certainly should do that right now. Anything to add, Shiva, before we let you go?
I'm sorry, can you repeat that?
Anything you'd like to add before we let you go?
Sure. I would like to suggest that, you know, they're using an online appointment system, and it may be a bit more difficult for the elderly or persons who are not familiar with technology to make those appointments. So persons in the community who are familiar with it, they can offer to help, and also in terms of helping persons get to the vaccination site on the day. Some persons may not have transport, and these are simple steps that can be used to help persons to successfully get their vaccine. And finally, I would just like to encourage everyone that we strongly suggest that you get the vaccine that is available to you when you are able to. The risks that are associated with the vaccine are very low compared to the benefits that come with the vaccine. And I'm sure we all want to move on from where we are right now in this state of emergency and curfews and everything like that, and open back the economy. So I know there are a lot of people in financial hardship right now, and vaccination is the key step to allow that to happen.
All right, Shiva, thank you so much for joining us today. And, of course, we'll chat with you again next week at the same time.
All right, thank you, Vidya.